it? Because I can't see. Yeah, good.
Awesome.
Glasses off.
Look at us. We're just matching so well today.
I know, and we didn't even call.
I did not even think about this.
And look, Gizzy matches too. He's being good boy. He's being good boy.
He's ready.
He's ready.
He's
He's getting adjusted too.
Love it.
But his seat.
Yeah. So.
Okay.
Let's run through this. Let's go a sample timer. This could be the full time. I might just do a one take. I might be able to just be fine with it. Okay?
Right.
Hey guys, welcome. Dr. Dan here with Tammy H, the Realtor, and today we're going to do some special treatment for Tammy. Tammy's been my patient before. We've done some chiropractic, we've done some massage, and today I want to show you some VIP treatments. We're going to do a bunch of different skits here. We're going to show you everything that you want to see. Now, anybody that wants to see specific care styles of treatment, how you might take care of somebody like Tammy, or anybody else in particular, other influencers, other styles of treatments, I can show lower body, upper body, neck, spine, abdominal treatments. We're going to do a bunch of things here today, so stay tuned for more. If you want to see this VIP treatment, feel free to subscribe, and we will surely get all that going for you, okay? Tammy, when you're ready, we're going to go on over to room number 1, and we're going to start with the traditional chiropractic treatments, okay?
Okie dokie.
Awesome.
We'll move over.
Love that.
Just leave it on.
And we're going to be right here.
Just bring it around while we
All through the office.
Room.
Here we go. And we got our videographer.
The whole office, too.
The whole office. So we got the turf everywhere. We got all the fun stuff going on in here. Now, Tammy, where would you think the best angle for this table could be? If you think that angle there, I can always do it right at the footboard. I could do it at the headboard.
Wherever you think.
I think that might be just perfect. Yet again, we do some shoulder work. We'll do it right about here, seated, and we'll have some great times with this, okay? So, do you think that was a good intro?
And when do we need to?
Oh, we'll do it in the massage room.
Okay,
yeah,
perfect.
Absolutely.
Just so I know when we're moving that.
Yeah.
Okay.
And so we are completely uncut, unregistered, unedited right here.
Yeah.
So today, Tammy, she comes in today with your...
Well, remember I dislocated the collarbone a few months ago and you put it back in place?
I'm glad I was able to put that back in place nice and easily. So when it comes to your care today, I want to show the chiropractic treatments themselves. Now, we know that Tammy does not lay on her stomach. Most patients will lay on their stomach. But for the sake of Tammy, we're going to have her do everything face up. And there's no problem to press into her back, into her shoulders, and her neck. And it's okay to adjust anybody, any style that you like. And I'm going to show you all the fun stuff that we do here. Tammy's wonderful. She's here to give us as much energy as she can give us, and I'm going to give all the energy back, okay? Yeah. So Tammy, let's actually start with your neck like we typically do. You can lay on your back, face upwards, taking a look at what joints need to move the most. Now, she's been pointing to some irritations on that left lower neck. And do you have issues sleeping or more sitting, driving in the car and stuff like that? Where do you have your most troubles?
Sometimes I just get tense.
Mm-hmm. Now, your left lower neck, I'd like to push that one over as you're finding that too. So as the head bends over here, so everybody, as you push up and across, we never really twist the neck. You never want to take care of somebody that direction. We're going to send that joint over to that direction and make it nice and smooth. You got to find where it's tight. You don't want to push where it's just loose and stuff, so we're getting a little bend right there, and I like to stretch. Wow, we got quite a bit right there. So even starting with the neck, that felt good, right, Tim?
Yes, that's
good. I'm here to give you exactly what you want and everything that you need. Again, going through small joints, they all relate to spots in the neck. Now, for the shoulder, my hand comes on that shoulder spot here. We're going to take it across for the upper back. My hand places behind the scapula, and I press back and down. You might get pops, you might not, and it's okay because we're angling the way she needs it.
I'm more confident.
Everybody can see us over there? Wow, you're getting so many pops in there. Same thing with this upper back and shoulder. I'm going to slide my hand in that shoulder joint. Let the shoulder... There you go. I was a good little pop there.
That was.
Can we take the shoes off and do some toe pops, okay?
Yeah, we can.
Those are really nice. I might want a pair of pinks too, actually.
Pink LVs.
Right?
Aren't they cute?
They're very. All right.
Everything matches.
We're going to get some toe pops here. Just pulling them. You don't have to do anything specific for that. Now, for the first metatarsal, I'm going to provide a nice stretch to that. Coming on here, fifth metatarsal. Now, the hip. When you pull the hip, you want to hold nice and strong, and you get that hip to send on that one. The knee bend. We take the tissue pull outwards, bending, Get little pops in there. Tammy is very flexible, so we can take her pretty far on almost every adjustment. That was great. Ooh, you're still done with the pops, Tammy.
Mm-hmm.
Wonderful. Now let's go ahead and recheck. I'm gonna check your lower back, okay? So when you check the lower back in this direction, you want to really feel where the restrictions are. So yes, I'm pulling up into the sacroiliac joint and going across for the lumbars. So Tammy, when do you have any tenderness down here?
Sometimes it's in there as well.
Right in that right side.
Yeah,
So
that's
I do
right.
notice that tension is right where you're pointing, the L5. So when you have to feel that L5 there, you're finding that tension around the muscle, and naturally I'm gonna push side to side, and I'd like to get this side up so you're laying over here, okay? So lay on your left shoulder. Perfect. Now again, there's nothing special about this adjustment except for your patient who you're working with. We're gonna press right into, wow, that was smooth and easy. Let's do the same thing to the other side, okay? Now, every videographer knows we need cameras and microphones, so we're gonna put the mic on the low back this time, okay? Same thing here, simple bend. One more. That was amazing. We got some good ones in there. Now let's see, I can do another mid-back one. Let's do it seated first, okay?
Okay.
So as you're sitting here, you're gonna put your hands on the back of your neck, okay? So I'm gonna come back here and hold and lift you up, okay? Let me get the microphone. Actually, it's perfect where it is. Lean back. Jake, ready? There's a little pop there. You gotta lift that upper back and set it in motion. Those are all fun things that we've done here today.
Yes.
So tell me how you're standing and moving after that. That was really simple. There's probably some more to do, and I kind of want to do even more clicker tool with you.
Okay.
It's a little tight still, and I think I need to massage those.
Yeah.
Every chiropractor knows you can always try to adjust something over and over again, but once you realize you've exhausted all the adjustments, you got to try different treatments. Let's do some hammer tool before we go anywhere else.
Okay.
Now, Tammy, go ahead and lay on your belly, but you're going to put your elbows right on the headpiece.
Right.
Now, with my pro adjuster here, right? So we're going to push into that spine and just hold your cheeks up as we're extending and accentuating that curve. Amy's always going to feel better leaving this office. My job is to give you what you want, what you need every single time you're here. Tammy only trusts me with her body, and that's a cause I'm really thankful and blessed, because not every chiropractor is willing and able to do the stuff that I have here too.
Right. You have more equipment than most.
And they're not as cute as I am. And sometimes their teeth aren't so pretty. So.
Or they're not as friendly or accommodating.
Hey, when you have the same value system here, everybody's welcome. Everybody wants the right kind of love and care. I always try to be affectionate enough to take care of you for what you have, because I judge people from who they are, not what they are. As the whole world is a very judgmental place.
Or how they look, what they do. It's how you treat people.
And Tammy's got the best personality, so she's at least going to come in at least once a month, and she's always welcome back more. Now, Tammy, we're not done with your care plan, but everybody who wants to see Tammy's massage, stay tuned. We're going to do that in the next room over, okay?
All right, I'm ready.
That was good?
That's perfect. Let's
Good
see how many people. So we have 540.
Cool. We're looking for 1 million.
I'd like that. So share it out, because we're now going
Right.
to continue on the treatment.
Right.
Okay. They.
Love it.
So let me grab Gizzy.
Mm-hmm.
The Gizzy man.
Want me to grab camera?
Yeah, you grab the camera. I'll
Perfect.
grab Gizmo.
All right. We're going to the next room over, and we're going to do room number 2, where we're going to showcase the amazing therapies that I have in here. Now, I've invested quite a lot into this practice to give K-laser therapy, radio frequency, shockwave, the white one, and some massage techniques. So we're going to start with some simple massage techniques with her sitting right here. We're working on the traps in the neck, and you're probably going to enjoy the whole thing.
Okay.
All right. Ms. Tammy, we've done the shockwave before.
Yes.
We've done the myofascial
What?
blading before too.
He can go out on where? Yeah, you can hold him, do whatever you want. He's good. He won't. He doesn't. He's good.
So Tammy, I've always used these. We do have metal tools.
Right.
You might call them toys. I sometimes call them, everything in here is a toy, right?
Yeah.
So we're going to use our tools and toys for the upper back and neck, kind of
Okay.
loosen a little bit more for her today. Now, when it comes to the massage, we do want to get to the tissue that we're working with. So specifically, we can pull the shoulder, the straps to the
Okay,
sides.
let me
just a little
just
bit.
put on the other shirt so that way it works better.
Perfect,
Because other just
I'll give you some space.
yeah.
you
Well,
tell me what you need.
Yeah, no,
Just-
it's just so that
I'll
way
give you-
we
I'll-
don't
I'll
have
give you a moment. It's no oopsies.
yeah, no
We don't want to give any free stuff out.
no oopsies. When
Are there any other specific words that I should be and could be using?
yeah, I'd say oopsies are good.
Yeah, oopsies.
No oopsies.
No
That's what
oopsies.
we definitely don't want oopsies. Let me just do
For-
yeah, I'd say oopsies are good.
Yeah, oopsies.
No oopsies.
No
That's what
oopsies.
we definitely don't want oopsies. Let me just do this like this. And like this. And then we can get rid of the shoulders. We're making a tube. We're making a tube top.
Making it. Love it.
There we go. And so then we have no cleavage and no this. There we go. Okay, all done. You all can come back.
I can even say like, "Hey, massage with Tammy." Right, when I say-
Yeah. So
Awesome.
now we made a tube top.
So
and I can
should I intro it like, "Hey, now that we're here at the massage
Yeah.
with Tammy portion," or just like that, easy enough?
Yep,
Get right
that's
into
easy
it.
enough.
Awesome.
So
And you can
there.
close it up. Or at least
Now we-
80-90%.
So now.
All right, 3, 2.
All right, now that we've gone through the adjustments, now everybody who makes it to round 2, maybe this is round 3, I don't remember, but we're going to do some myofascial and some shockwave treatments for Tammy. Now, the tension in Tammy's neck is the lower half. We can imagine why. When we want to take the tension out of there, it's like a locked knot right here.
Yeah.
And if we're doing that, so before I get the oil out, we're going to do some just generalized muscle stretching
Right.
for her. So if you're going to ever stretch anybody's traps and neck, this is my favorite 2 ways of doing it. One, we're going to tilt your head to the left, the side of affected, and rotate it back. I put my thumb, come on over here, Jake. I'm going to put pressure right on the upper medial border of the scapula, putting pressure right on there, and taking the head down and looking her head down to the right. Now, Tammy, that feels kind of good and kind of tender, kind of bumpy, right?
Mm-hmm.
I feel that little knot right there. You
Yeah.
feel that little knot. This is more or less the trapezius muscle, right? The levator scapula, you tilt it up and back this way and down to the right, or down to the left like that. Pushing and just tilting the opposite direction. Giving more length to the deeper muscles of your traps. Now, anybody tries to push into somebody's traps and you're like, "Oh, I hate that," this is probably the #1 spot, and Tammy is good with pain. Tammy, you'd say you don't really hurt so much when people do body work on you?
Yeah, no, I don't feel pain the way you're supposed
She
to.
doesn't like react. She doesn't like owie like the most guys bodybuilders that I have in here. Back to
And
the
I'm probably tenser than they are.
She is, but she doesn't complain. That's the best. So having her get the right kind of care, it's easy work for me too. Again, I work out quite often, so when you use your hands, you should be pretty good at, well versed at all these styles of care. Let's do a little bit to the other side, okay, Tam? Same thing. We're gonna look over to this side and back down to the left. Oh, that's so bumpy, but that's okay. We're here to make it not as bumpy. The bumps are all from strength, okay? So when you work through that strength, you actually become loose, relaxed, less tense, and likely that pain should drop down quite a bit. Okay? So when you work through that strength, you actually become loose, relaxed, less tense, and likely that pain should drop down quite a bit.
Round.
And the shockwave is not the nicest. It's a painful tool that I have, and I'm not here to hurt Tammy today, but we're gonna do enough that we're gonna make these muscles nice and loose, okay? Let's turn this
Were
guy
you
up.
worried? Were you worried? I love this stuff.
All right,
I love
Tammy.
everybody.
We're gonna start this again at 50%. Nothing too crazy. We're gonna crank it up because I know you like it a little bit stronger, as it will be more effective. And you remember this one. So as an impact tool goes, working these traps, allowing the shoulder to drop down and below, lengthening the tissue, using tools like these, can be the most effective high power massage that you can ever really get. Now, Tammy, do you want me to turn this up a little bit?
Yeah, you can turn it
Let's turn
up.
up a little bit, okay? Let's go to 80%. Should be just fine there. And she's like already melting away. The goal with all my treatments are the same, to get you nice and loose so you can walk out of here without that stress that we all typically like to hold on to. It's like letting the rest of the world be stressed and we don't have to feel that too. That we all typically like to hold on to. It's like letting the rest of the world be stressed and we don't have to feel that too. And I'm making pretty strong, aren't I? I'm pushing down and then, yeah. There's no.
Doesn't hurt though.
I'm not being light on Tammy at all, but these treatments do work. So always consider your treatment options when you're dealing with a pain. Options when you're dealing with a pain in the neck or pain in the traps. This is very effective. Now, Tam, feel any radiating symptoms into your chest at all with this? Sometimes we can't get these middle ribs. That is just a resemblance of rib that runs to the front. So by no means is it a bad thing. It's just a symptom. We're gonna do the same thing to the other side, but before, let me wipe off that shoulder. How many viewers do we have here, Tammy?
I can't see that far
You can't
away.
see which corner, top left or top right. We have 300 up there.
Mm-hmm.
And then
that's
it
right. Should tell you how many likes
289.
on the other side.
We got 506 on that one. Love it. Let's do some more shockwaves to Tammy's traps. And we're gonna do some massages to both sides after. 3, 2, 1. Again, this is the more effective side. So working into that. Now you never want to go too close to the ear with this machine because it is quite loud. It sounds like a rock band going on here. I'm feeling the releasing under the tool itself, which is nice. Yeah, right there.
Mm-hmm.
Now, Tammy, what does it actually feel like to have a shockwave treatment? Does it feel electrical? Does it feel pinchy?
No, it just it feels like it's like vibrating slightly.
Hey, that's a good thing. Now, this tool is very effective for releasing a lot of tension and stress just as much as it can help to reduce cellulite. There's topic there. We can truly show that on individuals who have concerns with cellulite in the future. It can work great for actually belly tightness.
Mm-hmm.
We can actually tighten skin with this one as well. Because a lot of people say, well, chiropractic is just good for cracking backs. Well, no, I'm a little bit different. I can do that and then a lot more.
Yeah,
5, 4, Owie, 3, 2, and 1. Tim, you did really good with that so far, but I don't think you're completely done with the relaxation of your trapezius muscles and your neck. So I have the myofascial tools that I will use on you next, okay?
Okay.
Let's use oil, if you had a lubrication oil, coconut or grapeseed? Cocoa?
Whichever.
Coconut.
Whichever one you prefer. There goes go
I
sit on
prefer
the back.
coconut oil if everybody's
Okay,
wondering.
vete dormir ahí. Vete dormir.
Awesome. So just a little bit of oil choice
Good
here.
boy.
And we're going to have the head tilt down to the right. Perfect. Now, when you do myofascial treatments, you want to stretch the skin. So her arms are out down in front, her head's going to be down just a little bit. And we'll be pushing through and scraping at a 30-degree angle to the skin, not necessarily irritating the skin, but to manipulate the soft tissues underneath. If you're going to go ahead and treat anybody with myofascial, please don't do it more than they need, meaning if they start to turn red really fast, reconsider the styles of strokes that you're using on the muscles and work that deeper tissue before the bruising starts to happen. If it starts to bruise, the patient will not like it so much after the fact, but it should feel good. If they enjoy the whole process, you're probably doing them more benefits than harm. How's this feeling up in the back and a bit in the upper? It's okay?
Good. Yeah, fine.
Beautiful. Every time I see you, I expect it to feel looser and looser. Oh boy, that's a knot. It's a knot if I've ever felt one. 5, 4, 3, 2, and 1. Tammy, we're gonna do the other side a little bit, okay?
Okay. You're so well behaved.
Now, people ask me all the time, Dan, do you like being a chiropractor? I laugh at them and say I love it. And you can tell why. You get to work with so many amazing people. You get to help them in ways that most people don't know how to get help. Education is my number one, background, you want to say. Being a biology major in college, going into chiropractic college after that, learning how to manipulate tissues, manipulating people, maybe in a good or bad way, usually in a good way, and moving the joints, moving the soft tissues, understanding what people need and giving them exactly what they want, so they can, feel happy and complacent and content and, showing the love. So I never wake up like mad that I have to be a chiropractor, because look what I get to do. I'm not just adjusting, again, all the benefits and joys that I can provide. And guess what? I do all these same treatments to myself, or I get somebody to properly administer them, so I can have the same benefits without drugs, surgery, needles, or anything that might be kind of questionable for anybody. We're doing so good. We've definitely loosened up a lot of tissue. Jake, come on over here. Take a look at how these tissues are looking more pink. So we did a pretty good job. We didn't bruise anything yet. If we went a little stronger and harder with the metal tools, you might start to get that rosacea, that like petechia kind of symptom showing up there too. Now, Tammy, do you feel a little bit lighter, looser in the neck after doing this bunch of that?
Yeah, I do.
You do. That's really awesome. Now, you can always stop right there and see how the patient's doing and see them on a weekly or every other week basis. Tammy will probably see you in about